So MDS-MPN overlap syndromes really have their own big, designated category. So there's an umbrella category of MDS-MPNs, and then of course the poster child for this is chronic myelomonocytic leukemia, or CMML. So by definition, these diseases have features that both clinically, in terms of having cytoses and cytopenias, and also in their molecular landscape, cross over between myelodysplastic syndromes and myelodysplastic neoplasms. So for instance, a patient with myelodysplastic type CMML can have a molecular landscape that is more akin to MDS, but also some CMML specific or CMML defining molecular alterations, like a combination of SRSF2 and TET2. And then a patient with myeloproliferative CMML may have RAS pathway mutations that lead to the exaggerated proliferation of cells and the very elevated high white cell count that they present with. So again, really the genetics of the disease define the phenotype of the disease.